The program you are about to watch is underwritten by Allergan. The views expressed therein are solely those of these doctors. The skincare game doesn't belong to just the women anymore. In fact, more and more men are coming to my practice with a laundry list of desires to keep them looking their best. I even have a group of them right in my own house, raiding my bathroom for products and samples whenever they're home. In fact, I happen to have two of them right here. My husband, Dr. Jake Tedaldi, and my son, Luke Tedaldi.
I'm really happy to be here.
Nice to have you guys.
Welcome.
Yeah.
So skincare in our house has always been obviously discussed, but not necessarily adhered to. So Jake, let's start with you in terms of skincare and your family history and just everything that has motivated you to use a little more sunscreen.
Mostly you. However, one most important fact is that one of my sisters died of metastatic melanoma.
Sorry.
And so that opened my eyes even more so than my wife. She's like a wonderful conscience. She keeps me on track and gets me to wear sunscreen more often than I would on my own.
Is that the only thing that's part of your skincare routine, sunscreen?
Just about. I mean, washing my face regularly, that's my form of exfoliation.
And with what?
Soap, whatever's available.
So we have two extremes here. We
Okay.
have that
Sounds more like the men that I'm used to.
right, the gentleman that the man that uses sunscreen, thankfully, at least he uses
An
it.
Irish Spring.
And then we have the slightly younger generation who uses a few more products. Luke?
Yeah, I think, a lot's changed. I grew up, obviously, with a dermatologist for a mother. My introduction would be, hi, my name's Luke. I'm 35, and my mother is a dermatologist. So I have a lot of friends coming to me now, asking me what I have the inside track on, because I get a monthly care package from my mom with all the good stuff, all the goodies.
Nice.
Yeah.
That's wonderful.
And so what is your routine? What's your routine?
Ooh, I mean, varied, because I grew up watching my dad just wash his face with soap, and then my mom layer on the products. So when I do remember to, I'll start off with an exfoliator, and then a retinol, and then sunscreen. But that's pretty it. I try to keep it as simple as possible so that I remember.
You do use vitamin C, you do use an antioxidant, you do also use growth factor. I don't know how often.
Let me correct you. I have those things.
Okay.
I use them
and here we
sporadically.
begin.
Here we begin. Three
So,
steps.
as
Most
the
people can
oldest
typically
of my
tolerate.
four sons, he probably doesn't do it as diligently as the third and fourth son. What about you, Ava? What about your three sons?
Yes, so I'm currently in between husbands, and so I just have three sons. And
I love that.
and they're all, let's see what's so hysterical about that. But I own three millennials, and it's very interesting. My oldest son did have melanoma, and he's fine, but he uses sunscreen. The middle son is actually in dermatology training right now, and so he's the one who's like obsessed with sunscreen, and the youngest one still has acne. So, but I don't think I have been as evolved as you have, Ruth, with trying to give a whole layered step. But I'm motivated and I'm inspired.
Doris, you have a son?
I have a son and he's 26, so he's starting to care more about his skincare, but really mostly the soap and what it smells like. So he's into the experience of having a good cleanser that feels good and something good to shave with. My husband is starting to also pick up, but I don't usually bring my work home with me, so I have my stuff put aside, and I haven't really imposed that on my family. So if they didn't ask about it, except for sunscreen, which I'm vigilant about.
And Janine, your husband, does he listen to you?
He does. He listens to me. So he steals things from me. He steals my Skin Medica products from me. He steals my sunscreens from me.
Maybe you should get him his own.
He uses, well, I get him his own because we have two separate bathrooms, so I get him his own. But he'll put sunblock on every day. He'll reapply it in the middle of the day.
Wow.
He'll use growth factor. He'll use retinoids.
See?
And then interestingly
Wow.
enough,
I'm impressed.
and my husband's
He doesn't have an option.
My husband's an ex-captain in the Army, so he at first thought all that was ridiculous. And then as we started aging, he's like, so what's that injectable filler stuff? Tell me about that. So I'll do
Nice.
that for him. And now he's even, kind of interested in injectable wrinkle relaxers.
So Sabrina, in the dating world, are men like looking at your skin and saying, I'm dating this beautiful young woman and I need to have more attention paid to my skin?
I will say that they're probably in my age group coming in for injectable wrinkle reducers to minimize the appearance of their wrinkles versus maybe doing like a 7-step skincare regimen.
So I would say that we all have encouraged the men in our practices, our patients, and the men in our lives to at least put sunscreen on. Certainly the golfers, we have them put travel sunscreen in their bag so they're reapplying it. But do we see an increase of them coming into our offices, Doris, for injectables?
Do. I see men coming in. It is mostly the injectable wrinkle reducers to start with. And then they start experimenting a little bit more with the injectable fillers as well. So it's a slow growth, but it's becoming more consistent. It used to be the wives and girlfriends sending in their husbands, but now sometimes they're coming in first and sending in their wives and girlfriends.
That's right. And Jake, let me ask you a question. How many times a day, so Jake's a veterinarian, and how many times a day do people look at you, because you're a nice looking man.
Well, he was a model.
And he was a model, and say, your wife must do something to you. Do they say that to you?
Oh, they don't talk to me about that kind of stuff usually. I mean,
They're not blatantly hitting on you.
Well, no.
Well, that was a few years
my
ago.
patients are, but not their own.
They're trying to run away.
No, I don't often have those questions posed to me. I think people are either mostly focused on their animals, or they don't want to bring that up because it's maybe treading beyond what's appropriate.
But do your friends ask you? Do your friends say, hey, you're married to a dermatologist, and I was thinking about having something done? Or either that question.
Guys my age don't talk about that kind of stuff with one another.
Okay,
See,
and
my
Luke?
friends do.
Yeah,
My friends
interesting.
do.
Generational.
Tell us about it, Luke.
I've generally found that it's kind of event-based. So, for example, I was married this past September. and
Congratulations.
Thank you so much.
And you still are married.
I got the hardware to prove it. I am.
It's a hard thing to be.
And so having that event, having a goal, was important in terms of knowing what I wanted to look like. You've got something ahead of you that you want. It's that goal. And I know my friends will come up to me and say something along the lines of, I'm giving this speech, or I have this work event. What should I be doing?
Are they afraid of injectable wrinkle relaxers?
I wouldn't say afraid. I think it's become part of the vernacular. I think people are really starting to have conversations about it now and making it far less taboo.
There certainly are many devices that can affect our body image, our body fat and muscle. So what do you see?
Absolutely. I see that more men usually come in for those procedures. It's less taboo to maybe reduce fat on their body or build more muscle than it is to necessarily address something on their face. It's been my experience. Usually they come in for something to reduce fat or to build some muscle, and then they start asking questions about the other procedures that we offer in the office.
But in Los Angeles, I see a growing number of men who are coming in for these treatments, whether it be a little bit of laser, something to refresh their skin, something to treat other things in their face. They're into it. Better jawline.
But don't you find
better
men
this.
do it for different reasons than women? Men are doing it more because they don't want to be older in a younger job market, whereas women are doing it for different reasons than that.
Or maybe they don't want to be older in life.
Yeah,
And I
that's
think
true.
the truth of the matter is, even you probably, Jake, could imagine that there would be some procedures you would think about that would make you feel better, look younger.
I'm open-minded.
I think it's really interesting looking at the different pressures that are put on men. I think that for a while there was a lot of pressure on the body, but even then it's quite different from what women have. I think that the whole notion of a dad bod as being something that is acceptable or even enviable is shifting a lot more towards taking care of yourself. And that's always a good thing when you can combine aesthetics and health.
Okay, you heard it here, and hopefully all the men out there learned something new today. Want to be part of our Derm Squad? Like and subscribe to The Gist.